Good evening and welcome back to the second season of First Aid Chats by Dr. G. I am Dr. Adana Grandison, a physician in Barbados, and your hostess for this evening. First Aid Chats by Dr. G is a live podcast that provides listeners with a unique opportunity to not only hear complicated medical conditions explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. And this evening, I also want to tell you that we have successfully started our second season and we were rated number one in the top 15 first aid podcasts that you should follow for 2021 according to Feedstock. Now, this evening, our episode is entitled You Are What You Eat Nutrition and Longevity. And our guest is none other than Dr. Elliot Duglin. Dr. Duglin is a practicing family physician and has earned numerous preclinical gold medals in biochemistry, physiology, microbiology, pathology, clinical pharmacology, and therapeutics. He has worked at the Glebe Polyclinic here in Barbados for over 30 years and is committed to improving the health of his patients and dedicated to reducing the risk of developing non-communicable disease such as hypertension, diabetes, heart disease, stroke, and cancer. Dr. Elliot Duglin was also a recipient of the award for Health Heroes in 2017 by PAHO and WHO Barbados office. Good evening and welcome, Dr. Duglin. How are you doing?
Good evening and thank you very much. I thank you for your kind introduction. Thank you.
Dr. Duglin, I wanted to start this evening and I thought when I first decided about my topic for this year, I noticed that FAO actually stated that this year should be named the International Year of Fruits and Vegetables. And so I thought it was best that we started off right on nutrition. So, Dr. Duglin, exactly what is nutrition?
Well, thank you. Nutrition basically is food. Healthy nutrition is about eating a healthy and balanced diet. Food and drink provide the energy and nutrients that we need for growth when we are in childhood, for maintaining good health, for having energy to do what we have to do. So nutrition is about our intake of nutrients for good health, for growth when we are young, and for sustenance all throughout life. And when we think in terms of nutrition, of course, we'll go on to that. We think in terms of the big nutrients, the macronutrients, protein, fat, carbohydrate, water, and fiber. And eating healthily and in a balanced way, that is very important for good health.
Okay. So you spoke about the big nutrients or what we call the macronutrients and the micronutrients. Can you tell me some more about that?
Yeah, the macronutrients are well known. Protein, which would be digested to amino acids, and then our body uses the amino acids to build our own proteins, which are very important. Structural proteins, enzymes, other functional proteins. Then a carbohydrate yields glucose, and we need glucose for energy. And then fats are broken down to triglycerides, they are absorbed, and we need fats for energy too. And also, they are important starter molecules for some other important synthetic or building block molecules. Those are the big nutrients. Fiber is considered a big nutrient. It isn't absorbed, but it's very important for colon health. And of course, water, which we need because we are 70% on average water. So those are the big nutrients, and everybody knows about protein for building blocks, carbohydrate and fats for energy, but they're also involved in some of the building block, not only by providing energy, but some of the molecules there are involved in also building certain other important hormones, and structures in the body. Those are the macronutrients, and we've known about them for a long time. But it is only relatively more recently that the importance of micronutrients have become understood and significant. Also, in the macronutrients, there are certain minerals like sodium and potassium, which we need in fairly consistently, moderately large quantities. And then there are other minerals that we need in small amounts. They are usually called the trace minerals. But the micronutrients are certain vitamins and minerals and other plant nutrients called phytonutrients, which we now understand are very important in the whole process of maintaining health in terms of being antioxidants and anti-inflammatory and cancer preventing molecules. And there's a tremendous amount of research focusing on these micronutrients, especially the vitamins and the microphytonutrients, plant nutrients, which are so important in the fight against the chronic non-communicable diseases.
Okay. Now you stated, let's go through, break down the macronutrients first, because we started to speak about those. And I want you to actually tell me, started off by giving an example of some of each of these macronutrients, and really what does each of these macronutrients do for the body? And then we'll go on to the micronutrients, some of the common micronutrients.
Okay, we can begin with protein. Most people get their protein from a variety of sources. For example, animal products, meat and fish and poultry, eggs and milk. For those who are usually mixed eaters, for example, I'm a vegetarian and I'm a vegan. I get my protein from legumes and lentils and peas and beans, and also from nuts and grains. So all of those are protein sources, animal protein sources, plant protein sources, and proteins are broken down to amino acids. Our bodies absorb the amino acids and then put them together to make our own proteins. And proteins are so important. Our antibodies fighting infection, they're proteins. The liver makes very important proteins like albumin, which helps to maintain the amount of water in the blood vessels and prevents the leakage of water out into the tissues. Structural proteins like muscle and so on. So protein, very important for structural and functional integrity. All of our enzymes, which must oversee and catalyze all the biochemical reaction. Every single enzyme is a protein, and every biochemical reaction in the body needs an enzyme for it to be done. So proteins are of crucial importance.
Good, good. And can you go on to now tell me about carbohydrates? Because I know there a lot of persons, there's a lot of debate about should you eat carbs or should you not eat carbs. So tell us about carbohydrates.
The carbohydrates are found, for example, in the starches, your yams, potatoes, dasheen, breadfruit, also found in sugars like sucrose, and which is table sugar and so on. So carbohydrates are the foods that are going to be broken down to simple sugars, for example, glucose, and then the body will absorb the glucose. The muscle and liver can store some of that glucose in the form of glycogen. Glucose serves as the main energy source for brain and nervous tissue, and for indeed almost all tissues except the heart, which uses usually more fat than glucose. Now, there has been the talk about a zero or very low carbohydrate diet, but a big study not too long ago done shows that we shouldn't be either excessive or too low in carbohydrate intake. The study indicated that around 50%, 40 to 50% of our diet should be wholesome carbohydrates, because too low or too high shortened the lifespan. So carbohydrates are important. They're the good carbohydrates, like what we call the ground provisions here in Barbados and the Caribbean, whole natural carbohydrates. And this is not to be confused with the ultra processed refined carbohydrates and refined sugars, which are not wholesome which usually cause blood sugar spikes and excessive insulin secretion and lead to excessive obesity and ultimately insulin resistance and so on. But the wholesome carbohydrates are good. And the research is showing that we should not be very excessive in them or very low in our intake. Around 50% has been shown to be ideal for longevity.
Okay, so Dr. Doug Glenn, I'm going to pause right here because we have our first question for the evening by Margot. As a diabetic, can you experience diabetic neuropathy in your head in the form of a burning sensation?
Well, thank you for that question. Diabetic neuropathy can, in fact, affect almost any nerve. It can affect the nerves to the gastrointestinal tract, the nerves to the bladder, the nerves in the supplying the scalp and the head. So in various parts of the body, there may be various manifestations: burning in the skin, tingling, pain, uh, dysfunction of the bladder, dysfunction of the gut. So diabetic neuropathy can affect almost any nerve system, and yes, can affect nerves supplying the skin of the scalp and head and cause a burning sensation. That is certainly possible.
Okay. And as a diabetic, I'm going to go right back to those wholesome sugars. You spoke about that we should take in about 40 to 50% wholesome sugars. What is it about foods that would be considered low or moderate glycemic index versus a high glycemic index? What really is a glycemic index? We keep hearing that term being tossed around.
Yes, glycemic index means that a food, when it is digested and absorbed, causes a rise in blood sugar. The higher the glycemic index, the greater the rise in blood glucose after eating that particular food. The lower the glycemic index, it means there's less of a rise in blood sugar after eating that food. Take, for example, white flour. If you eat white flour, there is quite a spike in your blood sugar. If you eat oats, there's less of a spike, and study was done with diabetics showing that after eating whole grain oats, there was less of a rise in blood sugar than eating, for example, wheat, especially white or refined wheat. So whole natural carbohydrates like ground provisions, your yam and so on, because they are whole and natural and rich in fiber, the rate at which they're digested to glucose and the rate at which therefore the glucose is absorbed is relatively slow. So you get much less of a spike compared to eating refined carbohydrates that are lacking in fiber or refined processed sugary foods where the sugar is quickly, the sucrose may be quickly broken down to glucose and fructose and rapidly absorbed, causing a spike. And every spike in blood sugar, even if you're not a diabetic, causes glucose to attach to tissues, a process called glycation, accelerates aging and accelerates tissue deterioration. And also every spike in glucose causes or demands an increase in insulin, and usually a state can be arrived at called hyperinsulinism, which is a pre-diabetic condition. So you want to avoid high glycemic processed fiberless carbohydrates and use the whole natural fiber full plant-based carbohydrates in their whole natural form.
Great. So I'm going to go now to the next macronutrient that is riddled with lots of discussion, and that is fat. We hear a person say, use a keto diet, don't use a keto diet. Eat as much fat during your keto diet because your body loves to use fat. There's nothing wrong with fat. Tell me about fat. And is fat really important? Do we really need it?
Yes, fat is important and we need fat. There are good fats and they're bad fats. And although there have been many discussions on this matter, research has now given us some clear indication that you can't just go and eat any amount of fat and any kind of fat and think it is all right.
Right.
We know, for example, that the animal fats and the saturated fats have been demonstrated quite clearly to increase the risk of atherosclerosis, whereas polyunsaturated fat, monounsaturated fat, and especially the omega-3 fats have been shown to be very protective. Take, for example, if a person eats walnuts, walnuts are rich in omega-3, some monounsaturated and polyunsaturated. There's going to be an improvement in arterial stiffness, a lowering of blood pressure, a better functioning of the cardiovascular system. So walnuts would constitute a very good, healthy fat. If, in comparison, a person consumes a lot of cheese or a lot of saturated animal fat, arterial stiffness will worsen. So there are good fats and bad fats. We want to take in the good fats. For example, the nuts and the seeds used moderately, vegetables. Now, there's a lot of controversy over the oils. Some
Right.
people feel that pure oils used moderately, the best oil being first cold pressed extra virgin olive oil. A lot of research shows its benefits, but still some experts think we should be very minimal and moderate with these oils and get them in their natural form by eating the nut or the seed rather than extracting them from the particular thing and using it. So there's a bit of to and fro in the expert world there. So there are good fats, which are very important and can be used with good effect moderately. Bad fat should be avoided. Fats have their place. Fats are important. The thing about fats is that they do not cause a spike in blood sugar, and they do not cause the pancreas to have to secrete insulin. So they're not going to cause any insulin demand or hyperinsulinism. And for that reason, fats are going to be important. And then when you look at the good fats, polyunsaturates, monounsaturates, nuts, seeds, grains, and the omega-3s. Omega-3s in walnuts, avocado, flax, very good. Those are very good plant fat sources that are healthy and can be used to good effect, never in excess with anything, in moderation, and they're going to be very good for you as compared with the animal and saturated and high cholesterol animal food fats, which are not going to be as that good for you.
Okay, I have a question in terms of one of the touted healthy fats, and that would be coconut oil. Tell us about coconut oil.
Coconut oil, coconut fat, that is one of the subjects that is also controversial. What we do know is that the coconut fat is medium chain, and since it is medium chain, there are some benefits. It is not absorbed via the lymphatic channels, it is absorbed directly, so it can help absorption of certain fat-soluble things without much of the complications of going through the lymphatic channels. But more importantly, the medium chain fats are good for the brain in terms of helping with the formation of certain phosphatidal components of brain structure. The medium chain fats can also be good for helping to make certain important molecules, and that is where the advantage seems to be good for the brain, good for brain structure. The disadvantage comes in that people who are prone to elevated cholesterol because of certain inherited genetic defects in the liver, like hypercholesterolemia, the familial hypercholesterolemias, and a lot of them, and all of the defects we haven't even worked out. But if a person is prone because of an inherited defect for the liver to make too much cholesterol. In some of those persons, using too much coconut fat can actually elevate the cholesterol, not because there's cholesterol in coconut, there's no cholesterol in any plant product, but because of the mechanisms of synthesis in the liver and the medium chain carbon 14s can lead, carbon molecules or carbon chains can lead to a higher production of very low density lipoprotein in people so prone by an inheritance. People who are not so prone may use the coconut more liberally to a good effect in terms of brain production. So most of the experts advise moderate use. And if you have a cholesterol problem, and if the indications are that that cholesterol problem may be contributed to by an inherited enzyme issue in the liver, be very, very careful.
Good. So I'm going to hold on our next question because I'm going directly into the micronutrient content. So some of our micronutrients are broken down into our vitamins. Let's start with vitamins first. Really, what is the role of vitamins?
Well, vitamins are defined as nutrients we need classically in small amounts, but which are very important for example, the B vitamins as cofactors and coenzymes for a whole host of biochemical reactions, usually involved in energy. And those are especially the water-soluble B vitamins. Then there are the fat-soluble vitamins, A, D, K, and E. Very important in certain areas. A, for vision and skin structure and cell proliferative integrity. D is a master vitamin hormone that is so important. We'll have to talk a little bit more about that, not just for bone and calcium, but vitamin D is now clearly known to be a very important vitamin hormone for immune system integrity and immune system balancing, and also helps to reduce the risk of a whole host of cancers. Vitamin D is so important. E is a powerful lipid-soluble antioxidant. K is important in the clotting area, but now we know that vitamin K2, especially the MP7, helps to keep calcium out of arteries and into the bone, and therefore helps to keep arteries flexible and bone strong. Right. But the B vitamins, and then there's B12, so important for the nervous system, so important for blood formation, working along with folic acid. B12 we usually get from, B12 is made by bacteria in the gut of animals, so we say we get it from animal sources, and of course there you can supplement with B12. Folic acid usually from a whole range of vegetables. B12 and folic acid working together for blood and for what we call in biochemistry, carbon-1 transfer, the nervous system, and so on, very important. So these vitamins are crucial. We now understand that some of them can be used in higher doses for certain methods of defense against certain diseases. For example, the pro-vitamin A, like the carotenes, which we get from carrots, and lycopene from tomatoes. Those carotenes are very important as antioxidants and anti-inflammatory molecules, helping to reduce the risk of cancer. For example, vitamin C at a higher level helps to maintain healthy immune system, teeth and gums, and so on. So the vitamins classically required in small amounts, vital for survival. We cannot live without them. And some of them can be used in higher doses now that we understand their role as chemopreventers of certain diseases.
So we are currently in the middle of a pandemic, and persons are concerned about maintaining their immune health. And you spoke about some of these vitamins that are used to boost the immunity, for instance, vitamin D, vitamin C. Can you tell us a bit more about exactly how do they do this?
Okay, well, the immune system has two broad components: the innate or first responder component, monocytes, macrophages, general T killer cells, which can respond in general to anything. They're not specific, they're just first responders. Then there's the adaptive immune system, which is highly specific and reacts later on. And both are important, but as we get older, the innate or first response immune system tends to fall off, and the adaptive tends to become more inflammatory in how it reacts. When you're younger, the innate is sharper. So you find that younger people tend to do better against this virus, and older people tend to be a bit more susceptible. What vitamin D, for example, does is that vitamin D helps to produce proteins that prevent the spike of the COVID-19 virus from attaching that effectively to its receptor, the ACE2 receptor. Vitamin D also enhances the monocytes and the macrophages. Every cell in the body has a vitamin D receptor, including the immune cells. And when vitamin D is present at adequate levels, these cells function much better. And then when we come to the adaptive immune system, vitamin D exerts an anti-inflammatory effect so that the highly touted cytokine storm will be much minimized. So vitamin D is going to strengthen the innate immune system and keep the adaptive immune system from causing an explosion of inflammation, which might trigger the clots and the lung damage and so on. And it is therefore of critical importance. Studies have shown that people with low vitamin D levels are going to have more morbidity and higher mortality. And when you have very good vitamin D levels, the chances are that you will get through any respiratory virus, ordinary flu, COVID-19, even bacterial lung infections, much better with higher vitamin D levels than with lower vitamin D levels. So vitamin D is crucial. Vitamin C strengthens both arms of the immune system. It helps the polymorphonuclear leukocytes, the white blood cells, to be more active. By the way, high blood sugars diminish their activity, so pre-diabetes and diabetics do poorly when they're attacked by these viruses in that condition. Zinc also plays a very important role in strengthening the innate immune system. You don't want too much zinc or too little zinc. If you're taking a supplement, 25 to 30 milligrams would be good enough, because nuts and cashews and walnuts and seeds and green leafy vegetables should give you a good amount. But nowadays people eat so much refined foods or not enough green leafy vegetables and seeds and whole foods that they may need a supplement. So vitamin C and D and zinc keep the immune system, the innate immune system, sharp, while especially vitamin D preventing the adaptive immune system from causing an overexplosion of inflammation. And both those realities are very important in dealing with COVID-19 or any respiratory virus, for example.
Right. We have a question here. What about supplementing? Do you recommend taking vitamins such as vitamin C, as we may not be getting all our bodies need in our foods?
That is an important question for a number of reasons. First of all, there's a big controversy in the medical world about supplementing with vitamins. It is usually said that if you're eating a good, wholesome, balanced diet with enough fruits and vegetables and whole grains and so on, you should be getting adequate vitamin intake. At the same time, we know, for example, that most people do not get the recommended 5 to 9 servings of fruit and vegetables a day. And one study showed that, for example, in the year 2017, there were 11 million deaths globally from poor nutrition. So the statement that we should be able to get all of our vitamins from a good, healthy diet, though true, at the practical level, the research shows that 78% of Americans are metabolically unhealthy from poor diet, And the figures are not much different in England, in the UK. And here in Barbados, we follow those countries and the bad examples, a lot of refined processed food. So we are not eating healthy. So we can't use the argument that we should get all of our vitamins and minerals from a healthy diet if we are not eating enough fruits and vegetables. So some experts say, therefore, there is a place for careful, judicious supplementation. So that's one line of argument and counter-argument. Another thing is that a number of studies have shown that taking multivitamins have not achieved much. And yet when they've looked at individual vitamins like D at adequate level and C at adequate level, other research has shown that for those individual vitamins, there have been beneficial results. So the controversy is to and fro. I think there's a place for careful, judicious supplementation, sometimes not necessarily of vitamins if you're eating healthy, but for certain molecules you may not get in the ordinary diet. I'll talk a little bit about them later on, like grapeseed extract and pine bark extract and N-acetylcysteine and so on, and some of those other molecules which have been shown by research to be important. But yes, if you are eating a good healthy diet, it may not be that critical, but if you are on the move, have to be always moving fast and eating fast foods, a good, wholesome, top ranked, and you can check you can always Google and find the watchdogs on vitamins to tell you which are junk and which are wholesome. A good supplement, a good multivitamin supplement can do no harm so long as you are checking the authenticity and the source and you read it and see what the levels are. It wouldn't do any harm, but you can't depend on supplementation to replace eating healthy. We need to eat more fruits and vegetables, whole grains and nuts, and eat more naturally and simply, and eat a lot more veg than we're eating. And then if we supplement on top of that, we are on safe ground. But if we are smoking and excessive alcohol and eating badly and hope that a multivitamin can do the trick, it will not.
Right. You spoke about the adequate amount of servings of fruits and vegetables. What is a serving of fruits and vegetables?
That is an important question because they usually recommend 5 to 9 servings of fruit and veg a day. And they say most people don't approach that. Well, to explain a serving to people in a practical term, in a practical way, is important. And sometimes it may not be easy. So I prefer to say, for example, one large English apple is, for example, a serving of fruit.
Right.
Okay? A good long-sized banana is another serving. Half a cup of berries is another serving of fruit. A whole orange, a serving. So if you have one mornings on some orange, an apple, a banana, some berries, you have a good 3 to 4 to 5 servings of fruits there. When you come to your vegetables now, some broccoli, at least 3 heads of broccoli, a good serving of lettuce. That would be another. When we say, they usually measure it in cups, so a cup of lettuce would be a serving. Lettuce is fluffy, so you may have to press it down to understand how to get the cup. So we need to eat. I usually put it this way: instead of that plate being packed with just starch, get more greens on that plate, more green leafy vegetables lightly steamed, or more salad. Simply eat more. You don't have to be too legalistic in measuring every specific thing, because that makes it tedious and sometimes take the pleasure out of eating. Just make sure you're eating an abundance of veg and more fruit and some more grains and nuts. And as you get into it, you'll find that it is easy then to understand how you're measuring, because an apple would be a serving, and a good few, about 4 or 5 leaves of lettuce, that would be a good serving of a leafy vegetable. And you get the practical hang of the servings as you get into it that way. But you can also Google it and see the definitions and try your best. But to be practical, just try to get in more of them compared to the amount of starch you're eating.
Right. So a good way of looking at it is essentially for your normal average dinner plate, about half of your plate should give you
Yes,
great.
I've got half that plate with greens and veg. You know that you're on the ball.
Excellent, excellent. So you went on to speak about some of the other vitamins and, more importantly, minerals that sometimes we need, or not sometimes, that we always need within the body, because they're absolutely critical to performing important functions within the body. So we're just going to switch some gears a bit. And I wanted to explain really the importance of minerals and also water.
Good. Thank you. Now, minerals, like vitamins, usually play their important role as cofactors to enzymes. Enzymes are protein molecules that catalyze or cause biochemical reactions to occur. Every biochemical reaction in the body is catalyzed or driven by an enzyme. So we can't live without enzymes. Enzymes need cofactors. Some of these cofactors or coenzymes are the vitamins. Some of them are minerals. For example, a lot of enzymes require magnesium. Some of them require zinc. Some require potassium, though potassium is a macro mineral nutrient. Some require molybdenum. Some require manganese. Some require boron. These trace minerals are therefore essential for the function of these enzymes. And when they are lacking, the enzyme catalyzed reactions are not being performed at their optimum way. Take, for example, it has been shown that in a place like the United States of America that we consider top standard, 70% of Americans were found to be deficient in magnesium because of the highly refined processed foods they eat compared to 70 years ago when they ate more naturally.
Right.
So a lot of people are deficient in magnesium. As people grow older, they tend to be deficient in zinc. A lot of people may be deficient in selenium, deficient in manganese, deficient in molybdenum because of the highly processed refined foods rather than eating fruits and veg and green leafy vegetables and seeds and nuts. For example, cashews are rich in magnesium. Walnuts are rich in vitamin E and also in chromium. Pumpkin and the skin on, more chromium. Pumpkin seeds, zinc, and chromium. So when you use your seeds and your nuts and your whole natural food, you're getting these minerals. But in our modern, fast-paced, ultra-processed eating population, these deficiencies are more common. And magnesium is also important for keeping the immune system in tip-top shape. Magnesium and zinc. And magnesium helps to keep the functions of calcium in balance. And nowadays, when we tell people to take more vitamin D, we don't want them to be overloaded with calcium, hence the importance of magnesium and vitamin K2 when they're taking adequate vitamin D to keep the immune system in tip-top shape. So these minerals are very important, and you get them from more seeds and nuts and grains and your green leafy vegetables, and you can supplement judiciously where you think there may be a deficiency.
Okay. So we've spoken about some of these minerals. I'm going to pause here because we have a caller actually on the line. So I'm going to take that call first, and then we're going to continue.
Okay.
Good evening, caller. You're live.
Good evening, Doc. I have a question, and it's just a general health question. There's a tea that we used to see in our supermarkets. I've not seen it recently, but a tea called Jigolan tea.
Jigolan tea, yes. Yeah, the Jigolan plant.
you're familiar with it, and what are the essential ingredients in that tea, and what are the benefits of that tea?
Well, the Jayagulan plant grows in the east, Japan, China, eastern India. It has been used in folk medicine for centuries in those parts of the world. And recent research has indicated that, like the green tea, it exerts antioxidant, anti-inflammatory properties, helps to reduce inflammation in the body, and it also helps to minimize, to reduce the risk for certain cancers. It can be had, for example, in capsule form, the powdered leaf, Jagulan powdered leaf. It can be had in the tea form, and they're now working on an extract. But the research is continuing, and all the research is showing that it is very valuable in terms of antioxidant, anti-inflammatory, and chemo prevention of certain cancers. Very good stuff. Helps to protect the stomach lining, the uterine lining, the prostate, and it helps to keep the blood flowing. So if you're taking it, you can't overdo with any other blood thinner. It helps to keep the blood flowing. Is anti-clotting in its effect. So it is a good tea to use, like, for example, once or twice a day. Good stuff. It is bitter, and some people prefer the capsules, which they can order from through Amazon. But the research on Jayagulan is that it is a top leaf tea and a top leaf whole herb extract for helping in the fight against diseases, because it is anti-inflammatory, antioxidant, and exerts what we call an anti-proliferative effect. That means keep cell multiplication in order, helping to reduce the risk of cancer formation. Good stuff it is, Jayagulan.
Great, excellent. So we keep hearing this term being tossed around, inflammation. It is upsetting the inflammatory system. And we know that non-communicable diseases and inflammation are linked. I want you to just explain then the role in terms of putting together why nutrition is so important in terms of decreasing and preventing non-communicable diseases.
Thanks again. Now, what we have found out is that a lot of people are going around with an increased level of chronic inflammation in their bodies. Now, remember that basically inflammation is well known. If we get a stick or a cut and it gets infected, you get the formation of pus. We call that inflammation. That is a good process to fight an invading organism. But when inflammation is occurring and it is not directed at invaders, or if it is over explosive, even if directed against invading microorganisms, or if in the inflammatory process the immune system is reacting against components of the person's own self, we have certain markers to show the inflammation level is going up. One is the ESR, erythrocyte sedimentation rate. We can also check one called the C-reactive protein. If there is no infection and those levels are going up, it indicates chronic systemic inflammation, because usually of poor diet. One of the major causes of increased levels of inflammation would be obesity. Another cause would be poor diet, eating a lot of refined, processed stuff, and high sugar intake and no fiber. It has been shown, for example, that eating French fries, they check the inflammatory index after a plate of French fries, and in 2 to 3 hours, the inflammatory markers, they go up. Whereas if a person sits down and eats some green leafy vegetables or some fruits, inflammatory markers go down. So the level of inflammation is influenced by lack of exercise, lack of sleep, all those increase inflammation, obesity, poor diet, stress, and we live in a very high stressed world. All these factors, stress, lack of sleep, lack of exercise, poor diet, not enough micro phytonutrients, all of those can increase inflammation. And then inflammation is the what we would call the platform upon which is spawned all of the chronic diseases, because the inflammation can cause the arteries to become stiff and increase the process of atherosclerosis, hence heart attack and stroke. Inflammation is usually gasoline to any cancer that is trying to form. Inflammation will accelerate it. Inflammation drives colon cancer, prostate cancer, breast cancer, for example, pancreas cancer, and lung cancer. And by the way, vitamin C and E, selenium, and vitamin D, and more lycopene intake from tomato products and so on will reduce the levels, the risk for all of those cancers by reducing inflammation as well. So inflammation is a driver for all of the chronic diseases, and people are advised to reduce inflammation, frequent regular exercise, adequate sleep at night, learning to cope with stress, to relax, drinking more water, taking in more fiber, eating more leafy green vegetables and vegetables on the whole, like the cruciferous vegetables. Certain supplements are aimed at inflammation, grapeseed extract, N-acetylcysteine, pine bark extract, and so on. So we must educate our people to eat an anti-inflammatory diet and to try to live an anti-inflammatory lifestyle as part of the fight against the scourge of chronic non-communicable diseases.
We have a question. Well, we have two questions here in the actual blog. What can females do as they start menopause and the big headache starts? The slowed metabolism, thus the weight gain.
That is not an easy question, but it's an important one. It has been noticed that in certain parts of the world, like in the East, where grains that are rich in lignans, like flax and lentils and fermented soy, are used, that menopause is an easier experience for Eastern women than Western women, where those components in the diet are usually not a featured thing of Western nutrition. That is one thing to consider. Some women cruise through menopause, others have a rough time. There are genetic factors. It is not, therefore, an easy question to answer for every single person, because what may help one person may not help another. But it is usually found that exercise, adequate sleep, a healthy diet, and then omega-3s, vitamin E, vitamin K2, and getting enough what we call phytoestrogens in the diet may make the menopause easier. Now, phytoestrogens is a controversial thing. Flax, for example, the lignans in flax produce enterolactones which modulate the estrogen receptors, helping both to reduce the risk of cancer of the uterus and cancer of the breast in women, while making menopause easier. So flax is definitely safe, very female friendly. Flax, lentils, and other beans and peas. Soy is controversial in that there are some experts who think that the phytoestrogens may be a little bit too harsh for some women. Yet, when you check the research is showing that especially for the Eastern fermented soy, it definitely reduces the risk of all the female problems. So that the jury is still out there. But vitamin E, omega-3, flax, exercise, adequate rest, fighting obesity, all that makes the menopause easier on average. Some women are already going to find it easy genetically. Some women are already going to find it tough. So in general terms, healthy eating and certain phytonutrients can make it easier. That having been said, some experts still feel that, especially if menopause is rough in a younger woman, a woman going through a menopause and starts at 50, for example, compared to a woman starting at 60, that it may be cruel not to offer some form of hormone replacement therapy, which used to be controversial, seems to be less controversial now, and should be under expert care. So all of those factors have to be taken into account for the individual we're looking at, and find a common path to help that individual feel better during menopause and not pile on the weight, and help to look at healthy nutrition, exercise, rest, relaxation, coping with stress, and judicious use of certain supplements to make it easier. And it can be done.
Okay, I'm going to put the next two questions together. Can a protein diet really work for weight loss? And also, can you speak about how our brain is affected by poor diet and lack of exercise? And specifically, how a high quality foods can nourish the brain. This is especially important for those who are studying.
Okay, thank you. Well, the last one is about foods and brain.
Yeah.
And the first one was
about protein and weight loss.
Protein, yeah.
Diet, a high protein diet really work for weight loss?
Well, if a person is eating, you had the famous diet fads where people ate protein and fat and very little carbohydrate, and especially use dangerous fats. The research is now saying that that is unhealthy. And even if a person does it in the short term to lose weight, it should not be maintained for a longer than a short term, because it will cause problems later on. It is better to eat your protein, wholesome fat, and wholesome carbohydrate in a balanced way. You can do intermittent fasting, that is 2 meals a day. Right. Breakfast around 7, a second meal around 3, and nothing else but water. That's intermittent fasting, which has been shown to be very beneficial, because fasting is extremely good for the entire body, brain, and all of the organs. It enhances something called autophagy, where cells recycle and cleanse and heal and do much better than constantly being fed. So fasting, either a complete fast for a day or intermittent fasting, 2 meals every day, has been shown to be very good for brain health and overall health. So just to eat protein and try to lose weight by not eating carbohydrates and so on may be all right for a short-term start on the weight loss program, but it should not be carried too long, because the research is showing that it leads to problems. Better to eat smaller portions or do intermittent fasting and increase the exercise, and avoid what puts on the weight. The research shows in the Caribbean, for example, are sugars and flour. All the bread and biscuits and cakes and all the sweet things you see advertised, and all the sugary things. Sugar, if people avoid the refined processed carbohydrates, cut out the sugar and the flour, and just add their salads, their vegetables, the good wholesome ground provisions, and a good protein source. And instead of eating every 5 minutes, stick to 2 or 3 meals a day, and in between just drink water. There will be much, much less obesity. It is the sugar and the flour and the constant eating. In terms of the brain, well, nutrition in the brain, very, very important, because studies are showing that the brain needs good fats, the omega-3s, the polyunsaturates and the monounsaturates. So nuts are very good for the brain. Walnuts, pecans, cashews, all the nuts in moderation are good, but walnuts rank now as number 1. Pistachios, pecans, they are good nuts. They're good for the brain. Walnuts even help to reduce the risk of cancer. Walnuts coming at number 1. Then it has been shown that legumes like beans and peas are very good for the brain. The brain needs also, what happens is that we don't, although the brain uses glucose as its main fuel, glucose spikes hurt the brain. So diabetes, uncontrolled diabetes, too much sugar hurts the brain. You want blood sugars in their normal range. And in fasting, you get some degree of ketosis, and the brain thrives on these ketone bodies. So fasting, intermittent fasting and fasting, very good for brain health, because too much sugar, although the brain uses glucose as its main fuel, it doesn't want to be over lavished by glucose. You want the glucose in a normal level. You want some periods of glucose freedom and some ketosis. The brain functions well. Good fats are necessary for good brain health. Then the vitamins and the minerals. Vitamin D is so important for brain health. Magnesium. Zinc must be in the correct balance. Too little zinc or too much zinc, not good for the brain. Selenium, again, no more than 200 micrograms a day. And again, you get selenium from whole grains and so on, very good for the brain. So healthy nutrition, along with exercise, physical exercise, very important for the brain. Mental exercise, challenging the brain by reading and studying, very good for the brain. Peas and beans and legumes, very good for the brain. Adequate vitamin B12 and folic acid levels and B levels, the trace minerals, and then an anti-inflammatory diet has been shown, for example, like grapeseed extract, pine bark extract. And then there are certain, they have been shown by clinical studies to actually improve cognition. Pine bark extract is known as the pycnogenols. So yes, nutrition and lifestyle both play a very important role in brain health. Adequate sleep, adequate exercise, physical exercise, challenging the brain, eating healthy, periods of intermittent fasting, avoiding glucose spikes, the phytonutrients and phytominerals, all crucial for maintaining brain health, especially as you age.
Great. Excellent. Well, we have come to the end of our show, but the good thing is that we will be having you again next week to continue this conversation about nutrition.
Thank you.
Because we need to really get down and really dissect dietary fads.
Yes, we have to look at that.
Absolutely, which some persons think are great, like the Mediterranean diet, versus the keto diet, or the Atkins diet, or as you said, lots of protein, lots of fats, no starch. So we're really going to take a real in-depth look next week on diet. Now, for our listeners out there, I also want to bring to your attention that I know a lot of you may have loads of questions about COVID during this pandemic. And so this weekend, we are going to try to bring a special for you with a panel of experts ranging from epidemiologists, pathologists, virologists, and critical care specialists, all discussing COVID-19. So I encourage you to stay tuned, look out for the posts, follow us on Instagram, follow us on Facebook, and certainly tune in and share with a friend. Dr. Douglin, I want to say thank you so much. This was an extremely informative session. And I am sure, based upon what I am seeing here in the actual message board, that our listeners have thoroughly enjoyed this session. So once again, I want to say thank you. And to our listeners, I also want to say thank you to them. And also for those who were brave enough to call in. Once again, I encourage you to follow us on both Podbean and Anchor and join us both this weekend and next week for First Aid Chats by Dr. G. Thank you so much, Dr. Douglin. This was wonderful.
You're welcome. Thanks very much for having me. And I hope the information given will be a benefit to all. Thanks a lot.
Thank you. Good night, everybody.
Good night.